You go to sleep feeling completely fine, but you wake up the next morning in a state of absolute paralyzing agony. Your lower back, or perhaps the very top of your neck, is completely locked. Every time you attempt to move or turn your head, a sharp, violent, stabbing pain shoots deep into your bones. Sometimes the pain is so severe that the area feels hot to the touch, and you might even develop a mild fever. You rush to the emergency room, terrified that you have a severe spinal infection or a massively ruptured disc. The doctors run basic blood tests and take a standard X-ray. They return to your room, shrug their shoulders, and tell you that you just have normal, age-related osteoarthritis or a bad muscle spasm. They prescribe you painkillers and send you home. But the agonizing, hot, stabbing pain refuses to stop. If you have experienced this terrifying, sudden attack, you must listen very closely. You do not have a muscle spasm, and you do not have normal wear and tear arthritis. You are likely suffering from a microscopic chemical invasion. Today, we will explain the hidden reality of spinal pseudogout, how invisible crystals are physically grinding inside your spine, and how we can permanently stop the fire. To understand why your spine suddenly feels like it is on fire, we must look at the microscopic chemistry of your joints. Most people have heard of traditional gout, a condition where uric acid crystals form in the big toe, causing severe pain. But there is a second, highly destructive condition called CPPD, which stands for calcium pyrophosphate deposition disease. In the medical community, we commonly call this pseudogout. This condition does not attack your toes, it aggressively attacks the large joints of your body, including the complex hinges of your spinal column. Your spine is held together by small facet joints and thick rubbery bands called ligaments. The most important of these is the ligamentum flavum, which runs directly inside the spinal canal, sitting millimeters away from your spinal cord. In a patient with pseudogout, the body's chemistry malfunctions. It begins to manufacture microscopic, sharp calcium pyrophosphate crystals directly inside the joint fluid and inside the fibers of the spinal ligaments. Think of your spinal joints like a perfectly lubricated metal door hinge. Suddenly, someone pours a handful of crushed glass and sand directly into the lubricating oil. Every time you bend, twist, or move your spine, those microscopic glass shards aggressively grind against the delicate cartilage and tear at the surrounding tissue. This triggers a massive, explosive inflammatory response from your immune system. The joint swells violently, the muscles lock up to prevent you from moving the damaged hinge, and the nerves transmit a chaotic, burning distress signal to your brain. This unique chemical mechanism exposes a catastrophic flaw in how general doctors treat sudden, severe back pain. When a local doctor sees an older patient with a stiff back, they immediately diagnose them with osteoarthritis. Standard osteoarthritis is a slow, gradual mechanical wearing down of the joint cartilage over decades. It causes a dull, chronic, predictable ache. Pseudogout is entirely different. It is an acute, explosive chemical fire. If a physical therapist assumes you have standard mechanical arthritis and tells you to aggressively stretch your spine, they are making a terrible mistake. Bending and stretching a joint that is filled with sharp calcium crystals will only grind the crystals deeper into the cartilage, causing irreversible structural damage and triggering even more violent muscle spasms. Furthermore, swallowing generic over-the-counter painkillers will barely touch the pain of a severe crystal flare-up. You cannot treat an acute chemical crystal attack with the same generic exercises used for mechanical wear and tear. You must identify the specific chemistry of the fire to extinguish it. We cannot diagnose spinal crystals by guessing, and we cannot rely on a standard low-quality X-ray. We must act as elite medical detectives and utilize high-definition, multi-layered medical imaging. This is the ultimate diagnostic trap. A standard magnetic resonance imaging scan, or MRI, is actually not the best tool for finding these crystals. An MRI is excellent for showing water, spinal fluid, and soft nerves, but it is notoriously poor at highlighting calcium. If a doctor only orders an MRI, the crystal deposits might look like normal dark scar tissue, and the true diagnosis is completely missed. To find the objective truth, an elite neurosurgeon demands a high-resolution computed tomography scan, or CT scan. A CT scan uses highly advanced X-ray technology to create a 3D map of the bone density. On a CT scan, the calcium pyrophosphate crystals glow brightly. We look specifically at the ligamentum flavum inside the spinal canal and the capsules surrounding the facet joints. Instead of a clear, open tunnel, we will see thick, chalky white masses of crystallized tissue actively choking the spinal canal and crushing the delicate nerve roots. We then combine this CT scan with an MRI to see exactly how much the crystal masses are suffocating the nervous system. There is one specific variation of this disease that is a true medical emergency, known as Crown-Dens syndrome. This occurs when the pseudogout crystals attack the very top of your spine, specifically the C1 and C2 vertebrae sitting directly beneath your skull. The C2 vertebrae has a bony peg called the dens. When crystals aggressively deposit in the ligaments wrapping around this peg, they form a highly inflammatory halo or crown of calcium. The patient will experience a sudden blinding headache at the base of the skull, extreme neck stiffness, and sometimes a high fever. Because these symptoms perfectly mimic severe spinal meningitis, patients are often hospitalized and subjected to terrifying, painful spinal taps and massive doses of antibiotics. A simple, high-definition CT scan of the upper neck would instantly reveal the glowing crown of crystals, completely ruling out an infection and saving the patient from a terrifying, unnecessary hospital ordeal. Because pseudogout involves both a severe chemical fire and a physical obstruction, our treatment protocol is meticulously divided into two phases. Phase 1 is chemical rescue. If the crystal masses are causing severe pain but are not yet severely crushing your spinal cord, we bypass open surgery. We use live, real-time X-ray guidance to guide a microscopic needle directly into the inflamed facet joint or the epidural space. We inject a highly concentrated dose of specialized, powerful anti-inflammatory corticosteroids directly into the crystallized area. This acts as a massive chemical fire extinguisher. It rapidly neutralizes the immune system's attack, shrinks the swollen tissues, and washes away the inflammatory proteins. The acute, stabbing pain often vanishes within hours. However, phase 2 is mechanical rescue. If the disease has been ignored for years, the crystal deposits inside the ligaments become massive, rock-hard blocks of chalky bone. They push inward, causing severe spinal stenosis. The crystals act as a physical clamp, slowly crushing the spinal cord and starving the nerves of oxygen. In this scenario, an injection is useless. We must physically remove the obstruction. We utilize advanced, ultra-minimally invasive endoscopic spine surgery. Through a tiny keyhole incision, we insert a high-definition camera into the spinal canal. Using specialized microscopic instruments, we gently detach and pull out the thick, crystallized ligaments. We manually clear the glass shards out of the hinge. The moment the hardened crystal masses are removed, the spinal pipe is widened, blood flow returns to the nerves, and the heavy, burning numbness in your arms or legs is permanently cured. Many patients who suffer from these acute, agonizing flare-ups accept the pain because they believe their spine is simply deteriorating with old age. They spend thousands of euros on endless physical therapy sessions, ineffective joint supplements, and heavy pain medications that slowly destroy their kidneys and stomach lining. But let us look at the true cost of accepting a mystery diagnosis. If you ignore massive crystal deposits growing inside your spinal canal, the hard masses will eventually crush your spinal nerves completely. You will permanently lose the strength in your legs, you will lose your mobility, and you risk permanent neurological paralysis. You are risking your lifelong independence because your doctor did not order a specialized CT scan. For a fraction of the cost of years of useless treatments, you can have an elite neurosurgeon evaluate the exact chemistry and mechanics of your spine, potentially identifying the hidden crystals and saving your nervous system before the damage becomes irreversible. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution. But you cannot fix a highly complex chemical and mechanical spinal problem by guessing. If you have sudden, severe locked back pain, do not just accept a diagnosis of normal arthritis. Every spine is unique. Click the link in the description to upload your MRI and CT scans to our secure portal. Our neurosurgeons will personally review your imaging, hunt for the glowing signs of crystal deposits, and build your personalized, minimally invasive treatment plan. Stop living in fear of your diagnosis and stop treating the wrong disease. Let us find your solution today.